Good morning, everyone, and thank you. Thank you, Kelsey, and thank you, everyone. Thank you for the invitation to share some of the work that I've done in looking at the racial and ethnic diversity of Louisiana's nursing workforce. Just an overview. And I know we all understand, and it's like I'm speaking to the choir, but just some things that I want to make sure that we're all on the same page. We're going to look at what is diversity, why is having a diverse nursing workforce important, revelation through history, taking a brief look at the diversity of Louisiana's RN LPN workforce. And I want to say now that I'm just highlighting some of the findings from the work that I've done that I would encourage everyone to take a look at in both reports because it's a wealth of information, I believe. And then opportunity for questions. And ahead of the game, I want to say thank you again. So I think we all know what diversity is in terms of a wide variety of shared and different personal and group characteristics among human beings. These can be the dimensions of race, ethnicity, gender, sexual orientation, socioeconomic status, age, but it's a bringing together of those ideas. Why evidence-based reports on why having a racially, ethnically diverse nursing workforce is critical in achieving health equity. And this is not new work. And I think everyone on this Zoom meeting knows that this is not new work, that this work has been ongoing and that in terms of the basis for establishing the need for a racially and ethnically diverse nursing workforce, beginning with the Institute. And it's just one of the Institute of Medicine report on unequal treatment that was written and published in 2003 that actually described research that showed that there were differences in care provided to individuals based on their race and their ethnicity and gender. The Sullivan Commission report on diversity in the health professions in 2004. And then we were proud that we have the Future of Nursing 2010-2020 report, Leading Change, Advancing Health, which emphasized the need for a diverse nursing workforce. We had the National Advisory Council on Nursing Education and Practice, Achieving Health Equity Through Nursing Workforce Diversity, that came up with some great recommendations on how we can move forward and accelerate the path to increasing the racially and ethnic diverse nursing workforce. Then we have the Future of Nursing 2020-2030, charting a path to achieve health equity. And recently, one of the most recent reports in toward on unequal treatment, ending unequal treatment, strategies to achieve equitable health care and optimal health of all. And that was recently released in 2024. So why is having a diverse nursing workforce important? According to the National Future of Nursing 2020-30 report, the decade ahead will demand a stronger, more diversified nursing workforce prepared to provide care, promote health and well-being among nurses, individuals, and communities, and address the systemic inequities that have fueled wide and persistent health disparities. So here we see that we have to acknowledge that there are inequities, health disparities, and that the role of having a diverse nursing workforce can actually help to address those issues and to hopefully decrease those disparities. So specifically, a healthcare workforce that mirrors the population it serves, strengthens the trust between patients and healthcare providers, fosters cultural humility and removes sociocultural barriers, improves healthcare outcomes, decreases mortality rates among marginalized racial and ethnic minorities. Now, I always like to share that this is one of these strategies, and I think a very important strategy to decrease health disparities among marginalized communities. There are many strategies that can be utilized, but this, again, I believe is one of the critical strategies that we need to continue to work on. Why is history important? I would like to quote Dr. Ashley Graham Perel. She said she likes to use history to present to peers that we've been fighting for equity for a very long time. And then she said, I like to consider what has not been done before. How can we advance? How can we advance what has been implemented historically? And how can we shift to being actionable and accountable? So there's a reason that history is important. Those that failed, Winston Churchill said, those that fail to learn from history are doomed to repeat it. And that's something that we desire not to do. We don't want to repeat the negative components of our history that possibly have led to some of the health disparities and inequities that we're experiencing today. I wanted to share with you, just to remind you, and I know all of you are probably aware of it, in 2021, the National Commission to Address Racism in Nursing report came out. And this report actually gave historical perspective, looking at every aspect of nursing, where racism has played in terms of not only within our profession, but also that has impacted those that we are caring for. I want to acknowledge that the ANA Journey of Racial Reconciliation statement, the reckoning statement that when the ANA acknowledges, either through commission or omission, the negative impact that the ANA imposed on nurses of color. And so I truly appreciate the action of trying to address and try to deal and reconciliate those things, because still there's much work to be done. Again, we're talking about history, historical trailblazers in nursing. And I think all of us are familiar with Florence Nightingale, as also called the mother of nursing. But what we may not be familiar with is Mary Seacole, who also cared for the troops on the front line in the Crimean War, but she was denied by Florence Nightingale to participate. But she took that no as motivation, got her own funding together, and she went forth and she cared for soldiers during the Crimean War. And then we have Mary Eliza Mahoney. And I think many of you, and again, this is Black History Month, so I'm taking a little leeway with this. Mary Eliza Mahoney, the first African-American woman to work as a professionally trained nurse. She was one of the first Black members of the American Nurses Association. She co-founded the National Association of Colored Graduate Nurses because they did not feel welcomed at the ANA. And she was inducted into the ANA Hall of Fame in 1976. And I also learned about Mary Mahoney is that she didn't stay in public nursing due to the overwhelming discrimination she encountered. Instead, she went into private nursing care. So again, these are trailblazers within our profession. I looked at the National Association of Colored Graduate Nurses in 1909 because these individuals felt that Black nurses were not welcomed into the larger nursing organization. And so they felt it was so important because of the care that was needed by people that looked like them. And then we have the founders of the National Black Nurses Association, which is in existence and thriving today, that felt that recognized that in order to make a difference in the quality of life in our communities, Black nurses across the nation had to take the lead. Through the founders' collective vision, persistence, and commitment, all Black nurses now had an organization whose primary reason for being was to improve the health status and Black people in the United States of America. And these ladies gave funds out of their own finances. I think it was $10,000 apiece to begin this organization. So all of this leads to we had the 2010-2020 report in that I think we did was the first phase, first 10 years of this Future of Nursing initiative. And again, one of the main priorities within that report was to increase the diversity of the nursing workforce, and that included increasing the diversity of the nursing faculty and workforce to mirror the population served. And each state or action coalition was required to develop a diversity action plan. And I just want to share with you, it was mentioned earlier, some of the work that was done in those first 10 years looking at the diversity of Louisiana's nursing workforce. We were commissioned and funded to build to look at the racial and ethnic diversity and gender of our APRN workforce and our registered nurse workforce. We had a diversity think tank, and we had 75 thought leaders that came together from across the state. This was held at Pennington, and it absolutely a fabulous opportunity to gather together and to really come up with ideas on how do we address diversity in education? How do we address diversity in leadership? How do we address diversity in practice, increasing the diversity of our nursing workforce? And we came out with what I believe was a hallmark report, Embracing the Challenge, Enhancing Diversity in Louisiana's Nursing Workforce. And you can find, we had recommendations, it was a summary of the meeting, and you can find this report on the Louisiana State Board of Nursing Center for Nursing website, webpage, with awesome recommendations. Here are many grants that were given to our regional action coalitions to increase the diversity of Louisiana's nursing workforce by focusing on the pipeline. We had 5 regional action coalitions that actually participated in this work of these many projects across the state, which resulted in more than 50 nursing career presentations to more than 4,500 middle and high school students and 134 middle and high school guidance counselors. So this work was awesome. We also had, spearheaded by Lisa Coletti, Hispanic Student Mentorship Program pilot, where we learned a lot about the challenges that faced students, these students as they matriculated not only through high school, but in order to try and participate even in the mentorship program. And so then we come to the 2020-2030 report, the National Academy of Medicine report on the future of nursing. And now we're looking at charting a path to achieve health equity. And I want to say at this time that, you know, we're in the midst of a lot of many different challenges, many different things, changes, that guidelines that are taking place. And maybe I know that probably everyone that's on the Zoom call is aware of it. And so I want to say that the challenges that were in place a month ago are still here in terms of our healthcare system. And so even though we may change the language, but the whole goal is the same, to improve health outcomes for all people. So here, when 2020-2030 report, the challenge compared to other developed countries, the United States has the highest poverty rate, the greatest income inequality, and some of the poorest health outcomes. And we know what happened with COVID-19. It simply highlighted things that were already in place. Factors like our race and ethnicity, income level, sexual orientation, and the conditions where we live predict whether we will suffer from preventable, costly medical conditions, shorter lives, and have a fate possible. So we've probably all seen this drawing in terms of health equity versus health versus equality. The first schematic, this first schematic shows that that's equity, because what we found is that the resources that are needed are given in order so that we have the same goal. The lower schematic is showing that things are equal, but still we can't achieve the same goal. We don't have access to the apple. So there's a difference between equity and inequality. And so equity is essential to provide the resources that are needed so that everyone can have ultimately a healthy outcome. Okay. So charting the path to achieve health equity for our country, to advance health equity for all, the systems must be in place to educate, pay, and employ nurses are needed to permanently, and that's permanently, remove barriers to allow them to do this work, value their contributions, prepare them to understand and tackle these issues, and diversify the nursing workforce. And I also have a copy of included the strategic map, the Louisiana Action Coalition Strategic Map 2022-2025, to show where strengthening and preparing a diverse nursing workforce has been a part of that strategic map, I think, from the beginning. So again, I think it shows that it's very, very important. And I also want to share that the American Nurses Association put out a statement on January 23rd. ANA will not abandon our principles, nor our members directly and indirectly impacted by the various guidelines that are taking place. We will continue to champion diversity, equity, inclusion, and foundational as well as practical pillars of public health because of how fundamentally important they are to us in our country. So again, this work continues to be essential. So now looking at the data, I always like to use "In God We Trust, All Others Must Bring Data." I think the data is essential. I'd like to thank the Louisiana State Board of Nursing for the 2022 RN workforce data that was used for this project, and Louisiana Board of Practical Nurse Examiners for the 2022 LPN workforce data, and the work that was funded through the consulting firm that I have. Diversity is having a seat at the table, inclusion is having a voice, and belonging is having that voice be heard. These are the two reports. I'll be sharing highlights with you. The racial and ethnic diversity of Louisiana's licensed practical nurse workforce. And I believe this is the first report of its kind for our state. And then the racial and ethnic diversity of Louisiana's registered nurse RN workforce, which again, remember we did our initial report on the diversity of the RN workforce back in 2014, 2015. So I'll just begin with I'd like to share the racial demographics of the U.S. and Louisiana population, because many times in research, we'll read research articles and we'll look at the strategies that they develop based on their data. But we have to keep in mind that each state's data has its uniqueness. And when you look at this, you can see that when you look at the racial demographics of the U.S. and Louisiana, the U.S., and this is based on 2022 data, 75.8% white, whereas Louisiana is 62.4% white. In terms of Blacks, 13.6% nationally U.S., but yet in Louisiana, 33% of our population is Black African American. In the United States, 6.1% Asian. In Louisiana, approximately 1.9%, 2% Asian. And so we move far down the line that we can see that the percentages differ. And so when we talk about mirroring the population we serve, we have to make sure that we drill down the information that impacts our demographics in terms of our state. So now we look at the racial diversity of Louisiana's RN and LPN workforce. So we have that at 78%, and this is based on 2022 data, 78% of our nursing workforce in Louisiana is white, but 54% of the LPN workforce is white. In Louisiana, 18% of the nursing workforce or the RN workforce is Black, but yet we see LPN workforce, 44%. There's a significant difference. And the interesting part about research, that part that sparks me is always when I see these significant differences, my mind automatically begins to think about why. Why is there such a difference in the percentage of the RN workforce that's Black African American or minority versus that of the LPN workforce? And then we can see as we move forward, American Indian Alaska Native, 0.4% nationally, 0.8% in Louisiana. Native Hawaiian, Pacific Islanders, 0.1% the same. They're pretty much equal in terms of the U.S. and Louisiana. Two or more races. We had other for LPN, so 1% of our RN population is identified as two or more races, and then other 1% for both our RN and LPN population. So again, when we're talking about developing strategies to increase the diversity of our nursing workforce, it's essential that we use our state level data to do that. The ethnicity diversity of the U.S., the ethnic diversity of the U.S. population in Louisiana. Here you can see that, and based on 2022 data, 18.9% of the population is Hispanic Latino, and that's the U.S. population. When you see Louisiana, 5.6% of the population is Hispanic Latino. And so you can see what the non-Hispanic or Latino population is. So again, very important when we're talking about developing strategies, where are our greatest gaps in terms of their state versus the nation. Louisiana Hispanic, Latino, RN, and LPN workforce. Okay, you can see the U.S. 18.9%, Louisiana 5.6%, RNs 3% of our RNs are Hispanic, Latino, and LPNs approximately 2% are Hispanic, Latino. So we do, yes, we have underrepresentation of our Hispanic Latino population. But you can see that it's not equivalent to the gap with our US in terms of what our state is. The average age of our RN and LPN workforce according to race. Our races, the average age was around 45 years. We were looking at other race, 43 versus in our LPN, 42 in our RN population. You can see here 2 or more races, and we didn't have that for LPN, but for RNs, 39. That's really the youngest group of nurses within our demographics in 2022. And we're looking at Native Hawaiian Pacific Islanders. You can see that it's really the oldest in terms of our RN workforce at average age of being 47 years old. When we look at our Black African American, you can see that 44 for our LPNs, 45 for our RNs. And then you can see for our white RNs, it's 46 years of age is the average age of our nursing workforce. And then we look at RN workforce according to race and age, and we're going to see that here you can see other race, 2 or more races again. When we're looking at those that are less than 30 years old and those that are 30 to 39 years old. Again, showing that they're much younger. But again, when you're looking at the report, you're going to see actual numbers in terms as it relates to these percentages. When you're looking at our Asian workforce, 18.4% less than 30, 38.5 between 30 and 39. So you can see those particular racial demographics are our younger nursing workforce. Here you can see in terms of our white nurses, we have 20.6%, 50 to 59, 18.8% greater than 60, and followed by our Black African American nurses in Louisiana, 18.7%, 50 to 59, 15.2% greater than 60. So again, this is important information as we begin to plan and to target and to look at what the future nursing workforce looks like in Louisiana. In terms of our LPN workforce, we can see here that, again, our white nurses appear to be the older, 21.8%, 50 to 59, 17.4% greater than 60. We can see here that, again, our Asian nurses, LPNs appear to be the youngest, followed by our Native Hawaiians to be younger. So again, this information isn't available even in more detail in the actual report. The gender of Louisiana's population and the RN and LPN workforce, and we know that we are predominantly female profession. So when we look at the population of Louisiana, we see 51% female, 49% male. Whereas when we look at our RN workforce, we have 88% female, 12% male. And then when we look at our LPN workforce, we have 96% female, 4% male. And this is great information, but this is why it's so important to drill down. So what does this look like in terms of the racial makeup? Again, RN workforce gender by race. So what do we see? We know that we have a predominantly female profession, but then when we look at the variation in terms of our male workforce, and here we can see that Black African Americans, males, make up the lowest percentage of our RN workforce in the state of Louisiana. That's 6%. And so we can see that the largest percentage of males falls within the Native Hawaiian Pacific Islander racial group. But again, when you look at the actual reports, you will see that the number of Black African Americans, okay, is much larger than the number of Native Hawaiian Pacific Islanders. So although these are percentages, but then you have to equate those percentages with numbers. But and then on that LPN workforce, you can see that even the representation of males is even lower among Black African American males. Only 3% of our LPN workforce are Black African American males, followed by 5% of the American Indian, Alaskan Native. So now we're going to get into primary employment settings according to race. And again, I'm just giving you highlights. Both reports are filled with much more detailed information, but I'm just giving you highlights. Here, I put primary employment setting because I didn't outline all the racial groups. You can see here the majority, over 95 to 97% of these employment settings and so forth are between white and our Black nurses, although, and in terms of, and then we have the total RN workforce. So I'm just giving you the highlights. In terms of our employment setting, we have 82.7% of the nurses that work in ambulatory care are white, whereas 14.3% are Black, with a total of 10.4% of our nursing workforce working in ambulatory care. What you'll see here is that in terms of our hospitals, we have 76.7% of the RN workforce that working in hospitals are white, 17.9% are Black, with 60.3% of the total workforce working in a hospital setting. And the other thing I wanted to share with you is that in terms of positions, and there's a whole lot, another section on positions held, that 83.5% of we go to our LPN workforce, 83.5% actually report to their staff nurses, with 50.7% white, 47% Black, and 1.8% is Hispanic Latino. Whereas when we go back to our RN workforce and we're looking at the positions held, and we're talking about staff nurses, 63.7% of RNs reported being a staff nurse, and 76.9% were white, but 19.2% were Black, and 3.5% were Hispanic. Again, you can see in our nursing home here for our LPN workforce, 28.4% of the LPN workforce reported working in a nursing home setting, 37.4% were white, 60.8% Black. Assisted living, 44.2% white, 53.3% Black. So you can see in some of these settings, when we're talking about mirroring the population, that many times we will find that our Black African American nurses definitely sometimes exceed the population within our state in some of these locations for our LPN workforce. Very different for our RN workforce. Okay. And then we have RN specialty according to race. RN specialty according to race. And here you can see what stands out is that in psych, substance abuse, and mental health, 64% of the workforce is white, 34% is Black. When you have med-surg, 60% is white, 34% is Black. So what we found here, in some instances, we exceeded the population, whereas areas where where Blacks were substantially underrepresented were anesthesia, 9.2%, occupational health, 11.6%, perioperative, 13.9%, pediatrics, 14.6%, home health, 15%, palliative care, hospice, 15.2%, emergency trauma, 16.4%. So there are areas that, yes, like med-surg and like psych, substance abuse, mental health, that we have African Americans, Black African American nurses represented, but in other areas, they're very much underrepresented. In terms of our LPN specialty areas, again, what we see here is very different from our RN workforce. We see that our LPN workforce is very well represented in the majority of our specialty areas. Again, with geriatrics being where the majority of our LPNs report being working, we have 57.9% of the nurses working in geriatrics that are Black African American. And then we have nurses in leadership positions. And I thought that this was important to share. And when possible, I tried to compare findings from the 2014 work that we did with the work that we did when I did in 2022. And what I found is that between 2014 and 2022, the percentage of nurse executives who were Black African American decreased from 13% in 2014 to approximately 10% into 2022. The percentage of Black African American nurse managers increased from 15.2% in 2014 to 17.7% in 2022. So when we look at the diversity of our nursing workforce, when we look at the fact that, yes, our LPN workforce is very much diverse. Whereas when we look at our RN workforce, that same diversity does not exist. And then when we look at leadership positions, the number of nurses that we have available for leadership positions. So we have here that nurse executives, 10% in terms of our Black African American nurses. We have 18% nurse managers, 15% report being APRNs. And you can see that there's discrepancies that help us to develop and think about what are some of the strategic goals that we can have in order to increase the number of nurse leaders within our minority nurse leaders within our workforce, RN workforce. So then I just included a few of the recommendations. There are more in the actual report. In terms of our licensed practical nurse workforce, utilize best practices to attract and reporting admission, enrollment, attrition, graduation rates. I attend the Nurse Supply and Demand Council meetings as much as I can, Health Works Commission. I encourage each of you on the Zoom to attend those. They're open to the public, but there's various challenges within our LPN our schools in terms of the retention and attrition of our of students within the LPN educational programs in our state. And so they're very much diligently working on that. Removing barriers that prevent LPN students from successfully completing their education, develop innovative programs in middle and high schools to increase the pipeline of LPNs, especially male, Hispanic, Latino, and Black males. Develop a mentorship program for LPNs who desire to advance within their professional role. Because they're LPNs, we have LPN to RN programs, and that's great. I think we have to look more closely at the number of students enrolled in those programs and the number that actually graduate from those programs. But there are LPNs that enjoy their profession and enjoy being an LPN, but their desire is to move forward in that profession and to grow within that profession. In terms of our nursing workforce, our registered nurse workforce, design and implement a robust and measurable strategic plan for recruiting, retaining, and successfully graduating racial and ethnic minorities and male students from Louisiana's RN programs. Report and evaluate annual outcomes related to tracking admission and enrollment and attrition and graduation rates. Increase the number of racially and ethnically diverse nurse faculty teaching in RN programs in Louisiana. Implement holistic admission processes in our programs that are not solely based on GPA and standardized test scores. Prepare racial and ethnic minority RNs to assume executive and managerial leadership roles in all areas of the nursing workforce. That means in our educational system, in practice, in every area in research, in every area within our workforce. Implement processes, policies to ensure the presence of a racially and ethnically diverse RN workforce in all areas and settings, and revise, review, and eliminate all policies in areas of nursing that perpetuate discriminatory practices that may, although unintentionally, negatively impact racial and ethnic minorities. And so again, these are very important issues that as we move forward, again, I'd like to take the opportunity with Black History Month honor a modern day trailblazer. Many of you may have heard of Dr. Linda Burns Bolton. Dr. Bolton recently passed away, but she was truly a trailblazer, and especially with the Future of Nursing Campaign for Action. And what I'm going to try and do now, because she was one of the co-founders, she served on that committee. I'm going to try and do now. There was something I always share when I presented the Nurse Leader Institute, a video. So I'm going to see if I can do that now. Okay. Can you all see it?
We still see your slides.
That we are not just knocking at the door and hoping someone will open the door. We need to knock the door down.
And I love to, let's see if I can get rid of this.
We heard it, but we didn't see it.
You didn't see it? Okay, I'm sorry, but her whole professional career was knocking doors down so that nurses can have a place at the table. And so again, I think she's a great trailblazer and very important to the nursing profession as a whole. So these are some of the highlights from the 2 reports that I shared with you. And I'm open to answer any questions that you may have. And again, I thank you for the opportunity to share this work with you. Thank you.